Hello, everybody, and welcome back to yet another episode of the AIP podcast. Again, it's me and Cheng from SuperCharge Lab on behalf of the AI Partnerships podcast. And today, we are absolutely delighted to welcome Sourav Sengupta from Small Joys, a pediatric behavioral health company, forming collaborative care partnerships with primary care physicians. Founded in 2020 and headquartered in Fort Lee, New Jersey, Small Joys helps children and adolescents achieve, maintain, and enhance emotional well being using artificial intelligence and creative storytelling. Well, welcome once again, Saurav. It's great to have you on our podcast today. Let's have you talk a little bit about how you got started with Small Joys. What's the backstory and how you came about to creating this company?
Sure. Thank you. Thanks for having me here. It's a pleasure to be connected here. Small Joy started when I became a father for the first time, and I started having clinical anxiety for a period of year because I felt I was not adequate as a father. I'm not ready to be a parent yet. Yet now, we are raising a child, and that kind of resulted into a clinical anxiety and made me interested in mental health and well-being for people. And when we were starting this company, we wanted to understand which segment of the population we are most passionate about. And me being a father, at that time, I thought that it is the pediatric population that we are most passionate about. So it was kind of a very organic decision to build a pediatric mental health company.
I see. Well, tell us a little bit about how Small Joys builds these authentic connections and promotes emotional well-being for pediatric clients in services.
So, even before I go to, how we do it, maybe I take a little bit of, I digress a little bit and explain why we do it. When I was going through my phase of clinical anxiety, one of the things that I found out is connecting with other parents who have recently has children and they are now struggling to deal with their parental experience helped me a lot. That connection made me feel that I am not alone. That's the first thing that I understood. And second, talking to them helped me, felt heard. And that's where the whole idea of a community or a targeted micro community popped into existence. Like, this should be the reality that people who are struggling with mental health challenges should have. So that's kind of the genesis of trying to build an authentic community. Regarding how we build authentic community for young adults or adolescents or pediatric population, um, we when a patient goes into a pediatric practice, in the pediatric practice we call them screeners or surveys of questions. They fill out tons of surveys. They start with pediatric checklist. We ask them some surveys on depression, anxiety, addiction, um, adverse childhood experiences, their perceived stress. So there are a variety of surveys we actually ask them. That gives us a ton of data around who these individuals are. And that data helps us build customized cohorts that should be together within the online platform.
I see. Tell us how, particularly children and adolescents benefit from Small Joys.
So there are multiple things that we do. First thing that we do is identification. In many cases, especially with the pediatric population, what happens, behavioral health or mental health is not identified um, as early as it should have been the situation. In most cases, what happens is we identify that somebody is suffering from a challenge once it has been there for quite some time, and now it has started to act them in a way that their parents are identifying. So that's the first piece that we focus on, where it's all about identification. every child, or I should say almost all children, go to their pediatrician. And we partner with pediatrician to identify people who need behavioral health support. Once we identify that they need behavioral health support, then we create a combination of app versus therapy experience for them. The app gives them the access to peer community, and the therapy with the therapist gives them relationship, peer-to-peer group therapy relationships, as well as individual therapy relationships. So this combination helps them deal with their mental health challenges.
That's very fascinating. So, what are the differences, particularly in using this service in an educational setting as opposed to a healthcare setting?
So, in healthcare setting, there are pros and cons in both. In an educational setting, it's much easier to provide such a service because you're not dealing with HIPAA compliance as such, right? So that way it becomes easier for us to offer such solutions. But on the other hand, you also don't have the rich data that a pediatrician can collect, right? A school cannot collect as much rich data as possible as a pediatrician can collect. So from the healthcare setting, what happens is we had to be HIPAA compliant to work with healthcare professionals. But we can also collect ton of data, like the physical indication of how somebody's doing, their blood pressure, heart rate, all of this physical indicators are available to us. On top of it, we get the behavioral health indicator from the screeners that gives us access to a rich set of data from the physicians.
I'm sure a lot of parents are probably wondering right now, how do you give access to these therapists, to the children and adolescents on your application, and h- how qualified are these individuals?
So there are a couple of ways. First is to talk to your pediatrician, and the way we work is we are not another referral behavioral health practice. We don't work with pediatricians who are referring patients to us. Our business model is collaborative care model. What that means is a pediatrician, a psychiatrist, and our behavioral health therapist are working together, breaking down silos of care, and they are all in a one single system, and they are helping each other, augmenting the outcome of patients behavioral health journey. That's where the power of our model is, rather than any other behavioral health provider. So the way the best to work with us is talk to your pediatrician. If we are currently not working with your pediatric practice, ask your pediatric practice to reach out to us so that we can, integrate our behavioral health collaborative care model within your pediatric practice set. That's one way of working on. There is another way of working with us. In case if we are not integrated within your pediatric practices, then we can bring you in within our network of pediatric practices, where the pediatrician and the behavioral health providers are working in tandem to serve the whole child. So that's the model we believe in, because that has much better patient outcome than siloed individual behavioral services that are out. Um, regard, Regarding the other question that you have on what kind of behavioral health specialists we work with, we mostly work with PhDs who has PhD in clinical psychology. In some cases, we also work with licensed clinical social workers.
That is great. That is great. That's really, really important because I think a lot of parents will want to have the best pediatric care for their clients. You mentioned that you are building a community. What are your plans in which you are going to get yourself out there to get this community started?
So our community is actually the same community of pediatric patients that are visiting their pediatrician. Our entire community is a private, tight knit community. It's not a consumer app like there are many consumer apps that you can download from App Store or Play Store. In our case, it's a private community that only has access through their pediatric professionals, and it's a very important piece of the whole solution. Pediatric health as we know it, especially the online use of community based organizations, we need to be mindful of how safe such online communities are. Um, Often, what happens in a consumer application, you would always have some bad actors. And then these bad actors are not in these applications for the purpose for which the application is built. And we want to be a private network connecting with pediatric practices primarily makes sure that there is no bad actor in our platform. That's how we make sure that the online platform is safe and secure. So we will grow through pediatric practices, through children's hospitals, through schools, but we will never be a consumer app where anyone can download an app and join the platform simply because we cannot control who is joining. And if we can't control who is joining the platform, there is a chance that it will not be a safe platform.
Great. Well, as a way to wrap us up, what amazing words of advice would you give to children and adolescents who are going through a rough time in their life right now?
I would say find your community. And this is something I have learned from my experience. No matter how difficult your journey is right now, no matter how isolated you feel right now, you are not alone. There are people who are going through something very similar to what you are going through. And you will find it really um, you will find it you will find the strength to deal with your struggles as you come in contact with a community that is going through something similar in life.
Great. Well, that's all the time that we have today for our podcast. Thanks again, Sourav, and to our listeners most of all. Sourav Sengupta is the founder of Small Joys, and it's Ann Cheng from SuperCharge Lab on behalf of the AI Partnerships podcast, signing off. Thank you.
Thank you. Thanks for having me here.